Governor DeSantis says more can be done to address ongoing public camping problem. Nearly 2 years after Florida banned public sleeping and camping on public property, Governor Ron DeSantis says the state may step up enforcement as homeless concerns continue across Florida communities. Speaking at a press conference in Broward County, DeSantis said he and Attorney General James Uthmeier are exploring ways to hold local officials accountable if they fail to enforce the law. DeSantis stated that the Attorney General is already reviewing accountability measures for jurisdictions that may not be following the statute, and he signaled a willingness to use his executive authority if necessary. The comments come after the city of Winter Haven was placed on notice when images surfaced showing unhoused individuals sleeping on playground equipment. City officials there say they are complying with the law and report shutting down 25 illegal encampments since the measure took effect. Florida's law prohibits counties and cities from allowing public sleeping or public camping on public property without explicit authorization. It also requires counties to establish designated encampment sites that prohibit drugs and alcohol and offer rehabilitative social services, providing an alternative location for individuals experiencing homelessness. Governor DeSantis called the legislation groundbreaking, saying most local governments have complied, but claims some areas are ignoring state law. He said communities have a responsibility to keep public spaces free of unsanctioned camping, and warning that elections do not override legal obligations. DeSantis also pointed to last year's U.S. Supreme Court ruling in City of Grants Pass v. Johnson, which held restrictions on public camping, saying it clears the way for stronger enforcement of Florida's laws. While the governor has broad emergency powers, including the authority to deploy the National Guard or State Guard, he has not yet taken such steps. No new legislation is currently planned to strengthen the law, meaning any increased enforcement would come through executive action. The issue continues to raise questions statewide, balancing public space regulation, homelessness services, and local government authority. All right. This is in your wheelhouse. What are your thoughts?
Put more money into mental health.
Mm-hmm.
I mean, you're trying to fix something that we've created ourselves, and put more money into mental health, and that'll help with alleviate a lot of this problem. We're not going to solve the homeless problem. I'm sorry. It's just not going to. It's been around for thousands and thousands and thousands of years. We're not going to solve it by writing the legislation.
Mm-hmm.
We're going to solve it with compassion, and we're going to solve it with hitting the core problem, which is mental health. And if you really want to do something about it, put more money into mental health. So.
Yeah, I agree. What do you mean by put more money into mental health? Do you mean facilities?
Making it more available.
Okay.
And some of these, and a lot of times, a lot of the people that we deal with don't see themselves as having a problem, or they'll get healthy, and then the medication makes them feel a little down, and then they'll relapse.
Yeah.
But we need to make it available to them. When we opened up State Road 16, we thought we were going to have this amount, and we ended up having 3 times the amount.
Wow.
So the facilities are necessary. The facilities are needed. You give the opportunities you don't have to do the programs yourself. There's nonprofits there. There's groups that are trying to be there and having a good heart to do it, but make that money available for them to ease that pain. It saves you money, saves us money, saves our medical bills a ton of money. If we had Florida Health Foundation in here, but if we brought in the actual administration of what they pay for the homeless at the hospitals, it's staggering. It's absolutely staggering.
Yeah.
So if you can avoid any of that, that saves us money. All that trickles down.
Yeah.
Yeah.
Well, there's legislation in place that an emergency room can't deny service.
Yeah.
And so as a result, anyone that doesn't want to pay for medical care will go to emergency rooms and just not pay the bill. So.
Yeah. And Barbara Jean asked, the homeless becoming a problem on St. George Street. Some of the people that are there aren't actually homeless. They see that as their job.
Yeah.
So they're not, there's only 26 identified homeless people that live in the downtown area. You know, and it seems like, oh my gosh, there's thousands of them.
Yeah.
No, there's 26, according to our point in time count.
Yeah.
You know, which we do every single year. You know, but a lot of the people are taking advantage of the
Generosity
the First Amendment,
Yeah.
because it's a freedom of expression, a freedom of speech, where they put a sign out, they can't approach you, and even that's being questioned now.
Yeah.
So a lot of those that you see there aren't necessarily homeless. Please don't give them money on the street. Might be the last dollar you give them. You don't know what their addiction is. If you want to give to an organization that you trust and believe in. Give locally, obviously, is the way I always want to do, because your money goes a lot further.
Yeah.
So we can take $1 and turn it into 25.
Yeah.
Through services where they're going to take $1 and it goes towards their next beer or their next you don't know what.
Yeah. And I can back that up because I worked at the winery for a while, and there were it appeared brothers that would panhandle on the corners of King Street, and I'm driving in and out every single day, and I'm seeing these guys, and I did give them money, and then less than a year later, turned out they were my neighbors. We lived in West King on different streets, and there was road construction, so I had to go down a street that I didn't normally go down, and they were out front working on 3 vehicles in a house, and they were going in and out of the house. I'm like, I gave those people money. They have nicer cars than I do. What is happening right now?
And Kenny, you making statements like that makes you part of the problem. Just letting you know, okay? Because I'm telling you actual facts. If you want to participate in helping, participate in helping. If you don't, then don't participate. But the numbers I'm giving you are the real numbers. So.
Yeah. I do have to ask though that for during like high peak tourism season, like during like Nights of Lights, how does like how does that affect like the homeless population? That like how does that affect like the 26 people that are in downtown? Like
the 26 are the steadies. You know, the other ones that come in, like I said, that are panhandlers. They're not necessarily homeless, like you were saying. The panhandlers might pick up a little bit, but a lot of the homeless that are there, they don't like that much traffic.
Yeah.
They don't like that much being in there. So they'll push out a little bit, and then they'll come back like during the week.
When it calms down.
On the weekends, you know, and because you can't sleep in the plaza anymore, that's pushed out more people also. So there's camps just outside the city, but inside the city limits itself, there's 26.
Yeah.